pigs, bats, horse, or marine mammals, like I showed you in the table previously. And these animal strains account for antigenic shift by genetic reassignment of HA or NA genes during co-infection in host cells. In 2013, a new strain of avian flu H7N9 infected humans in eastern China, resulting in severe illness, including deaths. H7N9 has been found in chickens, ducks, and wild birds in the live poultry markets in eastern China. This virus rarely emerged from reassignment or antigenic shift process. H7N9 continues to cause infection and death in humans in China even in 2017. There is no solid evidence of human-to-human transmission because most of the infected people had contact with sick poultry. Influenza virus infections in humans has been classified into 3 patterns according to WHO. For seasonal influenza, it occurs seasonally in the winter months. The incidence of influenza peaks during the winter. In the United States, influenza epidemic usually occur from January through April and from May to August in the southern hemisphere. Seasonal influenza circulate and cause disease in humans every year, which can spread from human to human through sneezing, coughing, or touching contaminated surface. Seasonal influenza spreads. Seasonal influenza viruses can cause mild to severe illness and even death, especially in some high-risk individuals, which are pregnant women, immunocompromised people, or people with chronic underlying medical conditions such as cancer, diabetes, young children, and elderly persons. Seasonal influenza viruses include influenza A, B, and C, and it can cause the disease every year. So individuals should be vaccinated with seasonal influenza vaccines annually. Next is zoonotic or variant influenza. Humans can also be infected with influenza viruses that are routinely circulating in animals. The infection may occur through direct contact with infected animals or contaminated environments. And the example of the zoonotic influenza shown here, which is avian influenza virus subtype AH5N1 or AH9N2, or swine influenza virus subtype AH1N1 or AH3N2. All of these animal viruses are distinct from human influenza virus, such as subtype AH3N2 circulating in swine is different from AH3N2 circulating in human. And these zoonotic influenza virus can be named variant influenza virus. Zoonotic influenza virus, they do not easily transmit between humans. Some zoonotic influenza may occasionally infect humans. And as I mentioned that there are 18 recognized subtypes of HA and 11 NA subtypes known to exist among viruses that circulate in birds and mammals. Once the zoonotic influenza virus infects human hosts, the virus may have some adaptation or acquisition of certain genes from human virus, and this could start an epidemic or pandemic, such as in 2011. Virus subtypes AH3N2 circulating in swine began to infect humans in the USA. Okay, this shows the HA subtype and NA subtype that I already mentioned. There are 18 HA subtypes and 11 NA subtypes. HA subtype that circulated in birds are H1 to H16, and the NA subtype are N1 to N9. In human, the NA subtype that most often circulate in human are H1, H2, and H3, while the NA subtype are N1 and N2. The HA subtype that frequently circulate in swine are H1 and H3 and N1 and N2. Recently, they found the new strain of the influenza virus that circulate in the bats, which are H17 and H18. And N10 and N11. Okay. Once there is reassortment between animal and human influenza viruses, a pandemic strains may occur. To date, all human pandemic strains have been reassorted between animal and human influenza virus, and pigs may serve as an intermediate host for the generation of human avian reassorted influenza virus, because pig cells contain receptors recognized by both human and avian influenza virus. Okay, next is pandemic influenza. Once the pandemic influenza viruses occur and these strains were not previously circulating among humans, so most people don't have immunity. This virus may emerge, circulate, and cause large outbreaks outside of the normal influenza season. The known virology confirmation of epidemics is in 1918 to 1919, which known as Spanish flu. Spanish flu caused an estimated 20 to 40 million of people dead worldwide. Subsequent pandemics is in 1957 and 1968, which results in many fewer deaths. And the pandemics in 2009, which is a novel swine origin H1N1 virus, appear. And it reached pandemic spread by mid-year of 2009. The virus was a reassortant which contains genes from North American swine virus, Eurasian swine virus, as well as from avian and human influenza virus. And the new strain of the virus that caused the pandemic in 2009 called H1N1 PDM09. This strain of the virus is contained in the recent vaccine. Okay, and this strain has become a seasonal influenza virus which continues to circulate with other seasonal viruses. The sequential reassortment of genes from human, avian, and swine influenza virus that occurred in 2009 generate the new strain of the virus, and pigs being an important mixing vessel due to their trachea containing receptor with both alpha-2 link and alpha-2 link sialic acid with galactose, as I already mentioned. So the pig's cell can bind to the influenza virus from avian and from human. And once the virus that infect the pigs has some genetic change and transfer to the human, the virus can bind to the cell's receptor at the upper respiratory tract, which is alpha-2 sialic acid linkage. And since the lower respiratory tract contains alpha-2 sialic acid linkage, so the virus can cause the severe pneumonia disease in human, and the virus spreads from human to human rapidly and cause the pandemic. Okay, this is the report of the number of laboratory confirmed cases and deaths of H1N1 influenza virus that spread during the 2009 worldwide. Okay. Information in this report is categorized by influenza transmission zones, which are geographic groups of countries, areas, or territories with similar influenza transmission patterns. And you can read more in detail about this from this website. In Southeast Asia, including Thailand, influenza B and H1N1 PDM09 are predominating, which different from other countries in different geographic groups, such as USA here, and China and South America here. Okay. For the mode of transmission of influenza virus, for seasonal flu, Spreading from person to person through sneezing, coughing, or touching contaminated surface is the important mode of transmission. For zoonotic flu, human infections are acquired through direct contact with infected animals or contaminated environments. Moreover, bird flu virus may be contaminated in droplet or dust in the air, so it is also the route of transmission of the zoonotic flu. Okay. For the pathogenesis, influenza virus infect cells in the respiratory tract because of the presence of their receptors. They multiply in serrated respiratory epithelial cells, leading to functional and structural ciliary abnormalities, and viremia is rarely detected. Viral NA lowers the viscosity of the mucus film in the respiratory tract and promoting the spread of the virus to lower portions of the tract. Within a short time, many cells in the respiratory tract are infected and eventually killed. And the immune system can produce cytokine, glycan, and cytotoxic factors. So all of these result in the bronchial asthma, COPD, pneumonia, or ARDS, which is acute respiratory distress syndrome. The incubation period of influenza virus is brief, lasting an average of 2 days. Symptoms of classic influenza include fever, myalgia, headache, dry cough, and occasionally shaking chill. The acute finding persists, sometimes with worsening. Followed by gradual improvement. About 1 week after onset, patients feel significantly better. Progressive viral infection may lead to pneumonia that may be lethal, especially in elderly adults and individuals with underlying disease. Rye syndrome is a serious complication that may develop 2 to 12 days after the infection. Rye syndrome is an acute encephalopathy of children and adolescents around 2 to 16 years of age. The mortality rate is high, about 10 to 40%. There is a possible relationship between salicylate use such as aspirin and Rye syndrome. So, in the children that infect with influenza virus, the precaution is not use aspirin because this has a risk for developing Rye syndrome. Suddenly worsening of symptoms suggests bacterial superinfection. Okay. Irene, could you please tell me that what species of bacteria that cause the infection of the respiratory tract, especially lower respiratory tract? Anyone can help Eileen to answer this question? Bacteria, yes. Okay, Staphylococcus aureus is one of the bacteria that can cause the super infection after influenza virus infection. Okay, another sample is Haemophilus influenzae and Streptococcus pneumoniae. Okay. Okay, this is the summary of clinical findings and complications that caused by influenza virus infection. In pregnancy, infections may lead to high risk of prematurity, smaller neonatal size, and lower birth weights. There are essentially three ways in which influenza may cause death, which are underlying disease with decompensation, especially in elderly adults, and underlying chronic cardiac or pulmonary disease. Next way is superinfection. Superinfection can lead to bacterial pneumonia or disseminated bacterial infection. Direct rapid propagation, such as Spanish flu that occurred in 1918. It produced fulminant deaths in healthy people, and H1N1 swine flu epidemic in 2009 that caused a high fatality in young people. For the diagnosis of influenza virus, during the acute phase of illness, influenza viruses can be readily detected or isolated from respiratory tract specimens such as nasal pharyngeal swab, nasal aspirate, or throat swab. Rapid antigen detection by enzyme immunoassay or EIA and genomic RNA detection by PCR often used. Serologic assay, which detect the antibody to viral proteins such as HA or NA, can be used too. The method used for serological assay are ELISA or hemagglutination inhibition. And this show the picture of the multiplex RT-PCR result to typing and subtyping of influenza virus and respiratory syncytial virus from clinical specimen. This can differentiate the strain of influenza virus, such as this line show the A Taiwan strain, H1N1 strain. The size of PCR product can differentiate each strain. The virus can be isolated and cultured from clinical specimen in cell lines and embryonic age. But it takes time around 3 to 10 days. While the multiplex PCR is more rapid. Routine zero diagnostic tests in use are based on hemagglutination inhibition and ELISA, as I already mentioned. To detect antibody against several virus proteins such as anti-HA or anti-NA, and pair, acute, and convalescent sera are necessary because normal individuals usually have influenza antibodies. A fourfold or greater increase in titer must occur to indicate influenza infection. The two basic approaches to management of influenza disease are symptomatic care and anticipation of potential complications, particularly bacterial superinfection. So, lest the patient get rest, intake adequate fluid, use of analgesics for myalgia and headache, and antitussives for severe cough. And must be emphasized that don't use drug containing salicylates such as aspirin with children infected with influenza virus because it increases the risk of Reye syndrome. Antibiotic prophylaxis had not been shown to enhance or diminish the likelihood of superinfection, but antibiotic prophylaxis can increase the risk of acquisition of more resistant bacterial flora in the respiratory tract and make it more difficult to treat. Two classes of antiviral agents are available for use against influenza viruses, which are neuraminidase inhibitors and viral protein M2 inhibitors. For neuraminidase inhibitor includes oseltamivir and zanamivir. Neuraminidase inhibitor competitively inhibit the function of the viral neuraminidase enzyme of both influenza A and B viruses. So, this can inhibit the cleavage of sialic acid residues on the surface of host cell and influenza viral envelopes, resulting in viral aggregation at the surface of the host cell and inhibition of virus release and reinfection of uninfected cells. These drugs are effectively in reducing the severity of influenza virus if taken within 48 hours of onset of illness. For viral protein M2 inhibitors include amantadine and lamantadine. Both drugs are not currently recommended because they have developed resistance against influenza A virus. Okay, and this shows the mechanism of antiviral resistance of viral protein M2 inhibitors. And you can read more detail from this website. For the best available method of controlling influenza infection is to annually vaccinate. And there are two types of influenza vaccines, which are kill or inactivated influenza vaccine and live attenuated influenza vaccine. Live attenuated influenza vaccine are suggested to given to healthy people, but it is not recommended for use in the unhealthy people like immunocompromised person because this live attenuated influenza vaccine contain the virus and it may cause the disease in the immunocompromised patients. Flu vaccine recommended for age 6 months and older and high-risk individuals.